Next, we talk about some peripheral nervous system injuries. These are injuries to, remember, the peripheral nervous system, not the head or spinal cord or brain or spinal cord. So some common peripheral nervous system injuries, the most common is brachial plexus injury. That's going to be caused by forces that alter the normal position of the arm. So think about shoulder dystocia, when the head's delivered and the shoulders are crammed against the pelvis because they're trying to come through at once. Think about a breech birth that might hyperextend the shoulders, or a difficult birth, maybe with a compound presentation. What does that look like? The arm hangs limply next to the body, and the shoulder and arm are adducted and rotated internally. The elbows extended, the forearms pronated with the wrist and fingers flexed. They do have normal finger and wrist movement, but they stay flexed unless they're actually moving. It is possible to have lower plexus injuries that affect just the hand, or total plexus injuries that affect the entire arm. When a moro reflex is elicited, it doesn't work on that limb. So they'll move everything else and move it gradually back in. This arm stays flaccid. Over time, the nerve tends to regain some function. So recovery can occur over 3 to 6 months, but they may still have long-term loss of function. We need to teach parents to position that arm properly, because the child is not going to have, the infant's not going to have muscle tone to keep the arm in position. Passive range of motion prevents contractures. We need to handle them carefully to not hyperextend the joints on that arm, and they're going to they may need long-term PT and OT to maximize their function. Facial nerve paralysis is caused by pressure on one of the facial nerves during birth. They may not have movement on one side of the face because of that facial nerve. Usually that's most noticeable when they're crying. It usually resolves within a few hours or days unless it's torn. If it doesn't resolve on its own, it may require some reconstructive surgery. This infant may need some help with suck and feeding techniques. If the muscles of the throat and pharynx are affected, they may require tube feeding until this resolves to prevent aspiration. Breastfeeding is not contraindicated, but it may be challenging if the baby cannot use this side, one side of the mouth, whichever side's affected, in order to get a good seal. If the eyelid on the affected side doesn't close, it needs to be protected from drying. They use artificial tears, ointments, and they may tape the eye closed when the baby's sleeping. Phrenic nerve paralysis is when the phrenic nerve actually innervates the diaphragm, so the diaphragm would be paralyzed. This, again, is a nerve injury to that nerve. It tends to improve over 2 to 3 weeks, but it may take a couple of months to improve as much as it's going to. But what does it look like? Well, if the diaphragm doesn't work on one side, that baby's going to have respiratory distress. It may look like or you may visibly be able to see that the respiratory effort is better on one side. The lung on the affected side may not completely expand with those first breaths. It's diagnosed with ultrasound. The treatment is managing respiratory distress and waiting for it to improve. The next section will be over central nervous system injuries.